Welcome back. Joining us now, Joseph Krimple from Pacific Coast Psychiatric. There's Joseph. Welcome. May is Mental Health Month. First question, new stresses of living with coronavirus. Mental health has been getting a lot more attention. More people looking for help? Are people finally over the stigma? And are you seeing more people, Joseph, who are asking for help?
Good morning, Walt. Thank you for having me. A lot of good questions there. Yeah, it's perfect timing for Mental Health Awareness Month. We have seen maybe because of coronavirus more stress in people's lives so that they're less concerned about stigma. We're offering mostly virtual appointments beginning from the Shelter-in-Place initiative. So it's maybe easier for people to think about getting the help that they have been wanting or need, especially now during this trying time. As Dr. Evans pointed out, a very weird and strange time for us all. And being able to talk to someone about the concerns for coronavirus or any other stresses in your life and having your family at home and working from home and all the stresses that provide, now is the perfect time to be able to speak to someone about that. And we're offering... Go ahead.
Yeah, I mean, just to play off of that, you have so many people who have such good reason to be stressed. And you mentioned a few of them, people working at home, loss of job, economy.
Sure.
Would you be more concerned about someone who's not feeling any stress at all?
That's really interesting because I have seen that quite a bit with some patients where this is not really affecting them very much at all. It's actually kind of nice for them to be home, to be around their family, to be cooking more often, to be in their car less, dealing with the congestion of just city life. So I have actually seen a lot of people enjoying themselves through this. And I would say then, to answer your question, the concern would be more for people who were showing symptoms of stress.
Makes sense. Makes sense. All right, next question for you. With shelter-in-place happening, more and more physicians and patients are turning to telemedicine. Mental health experts have been at that for years, though. How's this different, aside from the obvious? Is it just as effective as coming in for an in-person visit?
I think it's just as effective. As you mentioned, we've been doing this at Pacific Coast Psychiatric Associates for about 8 years, teletherapy and telepsychiatry. So this is nothing new for us. And we've acclimated very well, and being a company that originated in San Francisco, techie folk really enjoy this aspect of getting therapy and psychiatric care because of busy schedules. Everyone in Silicon Valley is pretty used to doing virtual meetings, so it was a very natural shift for them. But now we're 24 offices throughout the state of California, and maybe less than techie folks have acclimated very well to this process. I've had several holdouts in my career say that they didn't want to do virtual therapy. They prefer the in-office. And because of COVID, they've had to now switch and kind of get over that hump. And I don't think they're going to turn back anymore to in-office because of the convenience for this.
Next one for you is shelter-in-place, financial strains, general anxiety. All can put a lot of pressure on a family or a relationship. What are you seeing change in terms of the issues that couples are focusing on? And what advice do you have for maintaining sanity in this present situation?
I have seen more stress on relationships in the Shelter-in-Place initiative. There's less places to go to find that individual space or alone time that you may need to kind of reset or recharge the batteries. I would encourage anyone who's finding relationships to be more problematic during the quarantine and Shelter-in-Place to still try to find that me time somehow, to try to go to your separate corners, if you need to. And also, self-care should not be ignored during this time. So exercising, getting out and going for a walk, the different things that we can do that we know of our individual selves that make us feel better or happier or can offset some negative emotions or bad mood. Rely on all of those tools in your toolbox, and now is the best time to be using them, and maybe even finding more things to occupy your time. If there's a hobby that you've been wanting to embark on and haven't had the time to do so, now's the perfect time. reaching out to people that you haven't spoken with in a while, reconnecting with people, checking in on them. That's been something I've heard a lot happening with people coming out of the woodworks, and that's been largely positive to re-engage, to have more people to speak with.
Let me ask you this before we go, Joseph, because we're just about out of time. You have people come to you, I'm stressed, I'm worried, this and that. Do you look at them and go, you know what, you're completely normal for this, considering this time? Is that accurate?
Absolutely, absolutely, Walt. This is a very normalizing process in therapy to just let people know that they're not alone in this, that we are all kind of having to adjust, and that acclimating period can be very difficult at times for different reasons and for different people. But they're not alone. And that's a big part of this, is normalizing that stress for everyone.
Joseph Krimple, Pacific Coast Psychiatric. Joseph, thank you. Good advice.
This interview involves commercial content. The products and services featured appear as paid advertising.